Alright guys, here's the Module 3 discussion about our algorithms on how we treat different things. I did mine over cardiogenic shock. Cardiogenic shock it's the most severe form of pump failure. Cardiogenic shock is shock that remains after existing arrhythmias, hypovolemia, or altered vascular tone have been corrected. It occurs when left ventricular function is so compromised that the heart cannot meet the body's metabolic demands anymore. There's a few different things that can cause cardiogenic shock. There's mechanical issues, which involves like a tension pneumo or a cardiac tamponade or PE. Contractile issues, which would be like a heart attack, an MI, myocarditis, or even drug use can cause that. Few issues can be caused by trauma, such as hypovolemia. Neurological issues, renal and metabolic disorders. When you have cardiogenic shock, your body tries to compensate either by increasing contractile force, improving preload, or by reducing peripheral resistance, or it can do all three also. Whenever you have cardiogenic shock, your blood pressure is usually less than 80, and your heart rhythm is normally sinus tach, but not always. The patient usually presents as shock normally does, pale, cool, clammy, but it also has pitting edema a lot of the time. Most of your treatment for cardiogenic shock is treating the underlying symptoms, which would be like CHF or an MI, and mostly just supportive care. But the main thing you can do, the best outcome for the patient is going to be rapid transport to a facility that has cardiology capabilities. Here's my algorithm here. So step one, you're going to see how the patient presents, whether it's with signs and symptoms of shock, poor perfusion, CHF, or acute PE. Next, you're going to move down for your treatment. It's going to be, you're going to treat for hypoxia, avoid hyperoxia, place patient on cardiac monitor, pulse ox, and capno just to monitor them. Of course, you're going to initiate an IV. You're going to obtain baseline vitals, and you're going to get a history from the patient and get a physical exam and see what your exam findings reveal, whether it be volume loss, vasodilation, pump failure, abnormal heart rate can all cause cardiogenic shock. Treatment plan for volume loss would pretty much just be volume replacers like NS or LR. Same with vasodilation, but after you do NS or LR, you could also consider a pressor of some sort. Moving on to pump failure, you'd assess for signs and symptoms of acute PE. If no, then if your blood pressure is less than 100, you'd consider dopamine or dobutamine. If yes, you would probably put them on a CPAP, administer nitro, some kind of ACE inhibitor, and also a benzo for anxiety. And then you would still consider dopamine or dobutamine if the blood pressure is less than 100. If you have a normal heart rate, you kind of get off the track of cardiogenic shock, and if it's more than 150 beats per minute, you would move over and treat for tachycardia, and if it's less than 60, then you would just treat for bradycardia. And that's pretty much all I got. So, thank you.